All right, let's jump right into this explainer. Today we're looking at a really fascinating piece of clinical operations insight that completely reframes how we think about nighttime care. Now, if you're a senior care leader, you already know the night shift has its own unique, rhythm and set of challenges, right? It's that time when staffing is typically a lot leaner, the halls are super quiet, and the focus naturally shifts over to resident rest and safety. But what happens when a seemingly simple, standard medical note on a patient's chart actually represents this massive, hidden operational challenge for your entire care team? Well, we're going to unpack a recently published retrospective case series that sheds light on a highly specific yet incredibly common scenario. And it's one that plays out in senior care facilities every single night.
So on paper, the medical term nocturia kind of just looks like a standard bladder symptom. But 5 bathroom trips a night is not just a symptom. Actually, in the world of senior care, those nightly wake-ups cascade into something much, much larger. It's not just about the resident's interrupted sleep cycle, though, we do know from the source data that nocturia affects up to 80% of adults over 65, which is a huge number, but it's really about the compounding operational reality. It's about what physically happens in your facility in that real-world environment of dim lighting and quiet corridors, literally every single time that residents' feet hit the floor to use the restroom.
Because every single wake-up is essentially a hidden care event. Think about the mechanics of just one of these trips. It requires a physical transfer from the bed to a standing position. It involves navigating a dark hallway. It demands the attention and physical help of a tired caregiver who's likely already juggling multiple responsibilities on the floor. And most importantly, it creates a critical fall risk moment. When a resident is waking up 3, 4, or 5 times a night, you aren't just looking at a mild inconvenience. That's multiple high-risk physical events stacked back-to-back every single night. And that leads to severe daytime fatigue for the resident and a really significant measurable strain on your staffing resources.
Let's ground this theory for a second and talk about the numbers 5 to 6. This represents a very specific case documented in this retrospective series. We're talking about a 79-year-old man who is waking up 5 to 6 times every single night to use the bathroom. When we discuss care burdens, we have to look at the human reality, right? Imagine the sheer sleep fragmentation that happens when your own rest is broken 6 times between dusk and dawn. It's exhausting just thinking about it. Now multiply the physical exertion of getting out of bed, walking to the bathroom, and getting back into bed by 6. Think about the cumulative toll of that over a week or a month. And it's not just on the 79-year-old man, but on the care staff assigned to his floor.
Now here's where it gets even more complex. At baseline, his 5 to 6 nightly wake-ups were compounded by his reliance on a walker. That completely changes the equation. It makes every single nighttime trip a highly concerning fall risk issue for the care team. Trying to navigate a walker at 2 in the morning while you're groggy, that is a severe hazard. But after a novel intervention, the reported outcome was pretty dramatic. His wake-ups dropped to just 1 to 2 times per night. And even more remarkably, his daytime mobility improved so much that he actually transitioned from using a walker to just using a cane. That reduction in nighttime fatigue and finally getting unbroken sleep had a direct, measurable impact on his daytime physical stability and his overall independence.
So what exactly was the intervention that led to this shift? Well, it was surprisingly modest. It was an external herbal pouch therapy. The pouch is just applied directly over the navel and secured with a soft, breathable belt. For older adults who are already navigating super complex daily routines in polypharmacy, the true beauty of this approach is exactly what it lacks. It is entirely pill-free, needle-free, and adds absolutely zero systemic side effects or additional medication burden to their routine. It's just an external, supportive approach that works quietly in the background without throwing new pharmaceutical complications at the care team to manage.
Okay, let's pause for a quick reality check, because as senior care leaders, you need the straight facts. The source material here is very transparent. This is a retrospective case report based on patient-reported outcomes within a small 17-person case series. It is not definitive proof. The authors hit the nail on the head when they explicitly state that these preliminary findings warrant randomized controlled trials. So we are looking at early observational data here, not a finalized clinical mandate. Acknowledging this limitation is absolutely crucial. It lets clinical operations leaders view this not as some guaranteed cure-all, but as a really compelling operational clue. It shows us that addressing the specific mechanics of nighttime waking is possible, and it's definitely worthy of your serious attention.
So what does this all mean for you right now? How do you apply this insight to your operations today? Well, ask yourself, are you truly tracking nighttime wake-ups? Think about your morning stand-up meetings and your care reviews. If a resident in your care is waking 3, 4, or 5 times a night, is your team just treating that as a routine, inevitable part of aging that just has to be endured? Or are you recognizing it as a glaring early warning signal, a signal for caregiver fatigue, elevated fall risk, adult brief dependence, and even growing family concern? Because changing how you categorize these nighttime trips completely changes how you staff, how you plan, and how you deliver care.
The very first step here isn't about selling or implementing some brand new medical solution. No way! The first step is simply measuring the night. Start by tracking nocturia in your facility to truly understand your baseline. Then review the patterns to identify exactly which residents are creating the highest volume of nighttime care events. And finally, proactively protect the resident, protect the caregiver, and protect the care plan by addressing these frequent wake-ups head-on. It's time to start treating that 2 a.m. bathroom trip as the critical operational metric it truly is. Thanks so much for joining me for this explainer. I'm going to leave you with this one final thought. If you aren't measuring the night, what other major fall risks are hiding in plain sight in your facility right now?